Next. So this is something that's particularly relevant here in Taos. What is this? The next component of healthcare reform is the expansion of community health centers and increasing the healthcare workforce. In the law, Senator Bingaman called for major increases in funding for community health centers. The law allocates $9.5 billion for community health centers to expand their services, their hours, and their operating costs, or to deal with operating costs as well as for construction. Why is it important for community health centers to expand their services? Well, there's a direct correlation, obviously, between the services that community health centers operate and oftentimes keeping people out of the emergency room. So think about this. You've got a community health center, say La Familia or El Centro or maybe the new FQHC that's going to be potentially operating here in Taos. And they're open, say, till 10 o'clock at night, and they can also offer stitches. You're sitting there cutting, making a salad at dinner time, and you slice your finger. Where do most people go now? They go to the emergency room, which can be the most expensive form of medicine. It's also the most expensive, usually, form of medicine for hospitals to deal with because they have to keep it staffed full time to deal with a variety of things from, stitching a few stitches when you're making a salad to a gunshot wound that may come in, right? But let's say the community health center is open until 10 o'clock at night and they can offer the same services and you have less drive to actually get there. Assuming this is not a major artery, cut or anything like that. But that's the idea, that you can actually, one of the most affordable forms of medicine is through these QHCs or community health centers, and you can take people out of the emergency room, which is the most expensive, one of the most expensive forms of medicine, and translate them to a cheaper form of medicine that's right there nestled in the community. That's a major cost containment provision. The other thing is there's $230 million in grants to community health centers for establishing and expanding primary care residency programs to become teaching health centers. Why is this important? Well, most residents trained. Most of them are in hospitals. And the idea is when they get into community health centers, that's a very different form of medicine, a different kind of medicine. Some of them are very rural. Pecos Valley Medical Center, and then I've seen some other ones in the northeast part of the state that are more rural. Roy has a community health center that El Centro actually runs. You take somebody who's had a residency training in, the Bronx, and you put them in Roy, New Mexico, what are the chances of them staying to do community medicine? Right. If you could take somebody who's from New Mexico, though, and you train them in Roy, they may be more likely to stay in community health, more comfortable with that kind of model, and there you have more people staying in primary care, so there's an incentive to do that. The other thing is there's going to be an increase in Medicaid and Medicare reimbursements for those who are offering care in community health centers, which is obviously a major hotbed issue, and it's something that Senator Bingaman has been a long-time champion of, is to increase the Medicaid and Medicare reimbursement rates, but you also see it built into this law itself.